right now. Your kidneys are cleaning every drop of blood inside your body, every single minute. You cannot feel it. If they stop right now, your blood would start turning poisonous within a few hours. Not days, hours. Your body would stop making urine. Then your legs would swell. Then your lungs would fill with water. And one of the first organs to be damaged after your kidneys is your heart. This is happening to millions of people around the world right now, and most of them did not see it coming. The only thing standing between you and this, two small organs, the size of your fist. This is a kidney, about as big as your fist, sitting just behind your stomach on both sides of your spine. Inside, tiny tubes packed tightly together, all of them doing one thing, cleaning your blood all day long. Every day, your kidneys clean 180 liters of blood. That is about 45 bathtubs full. Every single day. They keep what your body needs. They throw away what your body does not. And they do this without ever stopping. Think of your kidney like a filter in a fish tank. The fish tank is your blood. The filter keeps the water clean. Without the filter, the water gets dirty. Fish get sick. Your body works the same way. Inside the kidney, tiny balls of blood vessels. Each one works like a very small sieve, squeezing waste out of blood. The clean stuff, water, sugar, good salt, gets put back into your blood. The dirty stuff becomes your urine. Your kidneys also control how much water stays in your body. Too much, they remove it. Too little, they hold it. They also help control your blood pressure and tell your body to make new blood cells. They do far more than just clean. Two kidneys working together, 24 hours a day, 7 days a week, every year of your life, never asking for a break. Now imagine both of them stop. Completely. Everything they were doing stops with them.
Doctor, if both kidneys suddenly stop working, what happens first?
Waste begins building up in the blood almost immediately because filtration stops. The moment kidneys stop working, waste builds up in the blood. Things that were supposed to leave cannot leave anymore. One of the first signs you notice, you stop making urine. You go to the toilet, and almost nothing comes out. Your body starts to feel very tired. Not normal tired. A deep, heavy tiredness that does not go away with rest. You may feel sick. Your mouth may taste like metal. That is the waste in your blood reaching your tongue. Fluid starts building up where it should not be. First your ankles and feet swell, then your face, then your belly, then the fluid reaches your lungs. Your lungs start to fill up. Breathing becomes hard. Every breath takes more effort. At the same time, too much of a salt called potassium builds up in the blood. In the right amount, it is fine. Too much, it is dangerous.
Why does urine output drop so quickly?
Because the kidneys can no longer remove water and dissolved waste. The heart starts to struggle. Its rhythm becomes uneven. Doctors have to act fast when this happens. Your brain starts to feel the effects too. You become confused. Your thinking slows down. You may feel dizzy. Your body tries to breathe faster and deeper deal with the changes in your blood. But breathing alone cannot fix kidneys. In very bad cases, small white crystals of waste appear on the skin, the body trying to push poison out through every pore. None of this happens in a nice, slow way. Once kidneys fail completely, the body goes into crisis. Fast, without help, a person with completely failed kidneys will become seriously ill within days. Their body cannot survive alone. But here's a remarkable thing. Medicine has found ways to keep people alive even when kidneys completely fail. A dialysis machine does the job the kidneys can no longer do. It cleans the blood from outside the body. A tube takes blood out of your arm, runs it through a cleaning machine, and puts the clean blood back in. Simple as that. Most people on dialysis go to a clinic 3 times a week. Each session takes about 4 hours. It keeps them alive, but is not as good as a real kidney. It does maybe 15% of what healthy kidneys can do.
How do doctors keep the patient alive at that stage?
Dialysis temporarily replaces the kidneys by cleaning the blood externally. The best solution, a kidney transplant. A healthy kidney from a donor is put inside the patient's body. The new kidney is placed in the lower belly. not where your own kidneys are. Doctors connect it to the blood vessels there. And within minutes of being connected, the new kidney starts making urine, a second chance, a new beginning. The amazing thing is, you only need one kidney to live a completely normal life. One is more than enough. That is why healthy people can donate one of their kidneys to someone who needs it and still be perfectly fine themselves. Now, here's the most important and scary thing about kidney disease. You usually feel nothing. No pain, no warning. Kidneys can lose half their power, and your body still feels normal. The damage is happening silently inside. By the time most people are told their kidneys are failing, a large part of the damage has already been done. The people most at risk are those with diabetes, high blood pressure, or a family history of kidney problems. A simple blood test once a year can catch problems early, before the damage becomes serious. Most people never get that test. Here are 3 simple things most people never know about kidneys. First, your kidneys make a hormone that tells your body to produce blood. Without it, you become pale, weak, and breathless. This is why people with kidney disease often look very tired and pale. Their body is not making enough blood. Second, drinking too much alcohol and taking too many painkillers damages your kidneys slowly, over years, without any warning. Common painkillers like ibuprofen, taken regularly over a long time, can reduce how well your kidneys work. Third, your kidneys are the reason you have normal blood pressure. Kidney disease and high blood pressure always go hand in hand. Fix the kidneys, blood pressure often improves. Damage the kidneys, blood pressure almost always rises. These are the quiet, invisible jobs that keep you alive, done silently by 2 organs most people never think about. Your kidneys are working right now, cleaning, balancing, protecting, and asking for nothing in return. If this video helped you understand your own body a little better, please subscribe. Every week, we explain one more part. Simply leave a comment telling us, which part of the body do you want us to look at next? Next week, we look at the valves inside your heart. Small flaps that stop your blood going backwards. What happens when they break? See you then.